Hello, my name is Dr. Ross Anderson. I'm one of the urologists at Urology Nevada, located in Reno, Nevada. This video, we're going to discuss a common problem for many men with enlarged prostate, or BPH, benign prostatic hyperplasia. Thank you for your time and attention in watching this video. This is an anatomic cartoon of the male lower urinary tract system. The bladder just above the green arrow is where the urine is stored, and when you empty the urine, it flows through the prostatic urethra. Common terminology we use in urology is BPH, or benign prostatic hyperplasia. That just means enlarged prostate. And LUTS, or lower urinary tract symptoms, are the symptoms men feel with enlarged prostate. As the prostate gland grows, it tends to obstruct the prostatic urethra. As you can see in this first drawing, as the prostate enlarges, that P channel, or where the urine flows from the bladder to the urethra, becomes blocked off. This commonly manifests as lower urinary tract symptoms, or LUTS, with decreased stream, hesitancy, intermittent stream, post-void dribbling, and sometimes increased urination at night, or nocturia. The long-term complications of prolonged blockage of the P-tube due to BPH is bladder failure, where the muscle can no longer squeeze hard enough to push the urine through the prostatic urethra. The picture under cystoscopy demonstrates what it looks like for us as the urologist as we look at a prostate that has overgrown and blocked off the urethra. The first step in treatment for lower urinary tract symptoms due to enlarged prostate is weight loss or other life. The first treatment for men that are experiencing lower urinary tract symptoms, we begin with lifestyle modification. That includes weight loss, avoiding things that are known to irritate the bladder and prostate, like caffeine or other stimulants, alcohol, decongestants like pseudoephedrine, spicy foods. We often recommend decreased fluid intake in the evening to decrease the number of times you have to get up to urinate at night. We also recommend elevating the legs a few hours prior to going to bed to take some of the fluid that naturally pools in the legs and return it to the heart. One of the most common classes of medications used for BPH is alpha blockers. They relax the smooth muscle in the prostate, and it's a good first-line therapy for mild, moderate, and even severe lower urinary tract symptoms. The most commonly used medication is tamsulosin or Flomax. This is a selective alpha blocker. Some of the most common side effects include dizziness, fatigue, nasal decongestion, orthostatic hypotension, and retrograde ejaculation. That means that when you ejaculate, instead of going out of the penis, it goes into the bladder, and then it's urinated out the next time you void or urinate. This is not dangerous, but can be surprising to many men. The next class of medications commonly used either alone or in conjunction with alpha blockers is 5-alpha reductase inhibitors. These convert testosterone to DHT in the prostate. Common names are finasteride or dutasteride. These work by shrinking the prostate gland, usually by about 0.25% of its original volume. It can help your flow or Qmax, and it can improve your symptom score by 20 to 30%. It does decrease the PSA by about 50%, so if we're following your PSA while you're taking finasteride, we know to double your PSA value. This can also help with chronic blood in the urine from the prostate, and it does promote hair growth. This medication is generally very well tolerated, but does have some side effects like breast tenderness, breast enlargement, as well as very rarely decreased libido or sexual desire and erectile dysfunction. There are a few situations where we should talk about surgery either up front or very early in the management of BPH. These include when the kidneys have started to fail due to the blockage of the prostate, urinary retention or unable to empty the bladder fully, or episodes where you need a Foley catheter placed because you can't urinate. When a man has recurrent urinary tract infections, bladder stones, or recurrent gross hematuria or blood in the urine. These are all situations where we should talk about surgery either upfront or very early. One thing that it's not recommended is for an asymptomatic bladder diverticulum or outpouching of the bladder. The American Urologic Association has recently published new guidelines for BPH surgery, and it's all about the size of the prostate for what surgery we can offer you. So it's important to get a sense for how large your prostate is prior to surgery. We determine this usually with digital rectal examination, ultrasound, MRI, or CT scans. As you can see, there are many different options for surgery for BPH. We want to try to find the right one for you, and here in the next few slides we're going to talk about a few of them that we offer here at Urology Nevada. The first option I want to talk about is called Urolift. This is a minimally invasive surgery that acts by pinning the obstructing or blocking tissue out of the way to make a good pee channel. This surgery is a great option for men without a median lobe and a prostate that is less than 80 grams. The main benefit with Urolift is that it can be done in clinic or in an outpatient surgery center. There are little to no sexual side effects like retrograde ejaculation with this procedure. The rare side effects of Urolift include blood in the urine, urinary tract infection. A rare complication would be due to misplaced pins of the Urolift device. The nitinol capsular tabs or pins of the Urolift device are MRI compatible. Like I said before, this does preserve sexual function in men. And I wanted to show you these other pictures to show you a before and after the procedure of making that pee channel tube opened up with the Urolift device. It does improve the maximal flow up to 3.5 milliliters per second. Transurethral resection of the prostate is the gold standard that all other procedures are compared to. We often refer to a TURP, and men often call it the roto-rooter. It is best for prostate glands of the small to medium size, less than 80 grams. Side effects include bleeding, urinary tract infection, retrograde ejaculation, and potentially low risk of scar tissue either in the urethra or at the bladder neck. Here is a picture of the inside view, or with our cystoscope while we're performing the procedure. This takes small pieces of the prostate out using electric cautery to make a channel for you to pee easier. This is a simple diagram with a cylinder that shows after the TURP that the pee channel should be opened up by removing the adenoma or the overgrowth of the prostate. Photovaporization of the prostate, or PVP, uses laser technology to vaporize the prostate tissue, in essence working the same way as the TURP does to make a good pee channel. There's a slightly lower risk of bleeding, so this is good for some patients that cannot come off of their anticoagulation. The outcomes are similar to a TURP as well as similar side effects, including UTI, bleeding, scar tissue regrowth, as well as retrograde ejaculation. For larger prostates, those greater than 80 grams, we want to talk about two different procedures that are commonly performed. One is called a HOLEP and the other is called a simple prostatectomy. The HOLEP uses laser technology to take out the prostate and then enucleate it inside the bladder, all done with endoscopy. The simple prostatectomy has been around for years, and this picture shows a finger scooping out the inside of that enlarged prostate gland. The simple prostatectomy has now been adapted to more minimally invasive or small incision robotic surgery, so we perform the robotic simple prostatectomy. A few more words on the HOLEP, or holmium laser enucleation of the prostate. This procedure is best done at high volume centers. It can potentially be an outpatient procedure, and it is all done with the scope, so no surgical incisions. The side effects include bleeding, urinary tract infection, stress urinary incontinence or leakage of urine, retrograde ejaculation, scar tissue formation, and very rarely bladder perforation. Due to my experience, for a 80-gram prostate or larger, I would recommend robotic simple prostatectomy. That's best in my hands compared to trying to do the whole-up procedure. Robotic simple prostatectomy is not a simple procedure, but it is different than the procedure where we remove the prostate for cancer. So this is not a cancer operation and does not have the same potential side effects or risks of surgery like stress urinary incontinence and high rates of erectile dysfunction. This is usually performed on one day and then you would go home the next day from the hospital. This link is to another YouTube video that I made as a surgical resident with Dr. Steven Summers, and it has more of the graphic detail as well as videos of the procedure being performed. So the main benefits for large prostates in performing the robotic simple prostatectomy is that you remove the most tissue. This is just an example of the large adenoma or regrowth, overgrowth of the prostate. This has the biggest improvement in the lower urinary tract symptoms as well as the urine flow when you compare it to every other procedure. The other benefit I find with this procedure over the whole-up is that the bladder neck is reconstructed, meaning the bladder neck is sewn back down to the urethra, covering up the large defect from removing the prostate. This decreases the risk of scar tissue formation at the bladder neck, as well as improves symptoms following the procedure. Retrograde ejaculation is a known side effect of this surgery, like many other BPH procedures, and then the other listed side effects of this surgery are all less than 5%. These include blood transfusion, urinary tract infection, urine leak inside the abdomen, ureteral injury or urinary incontinence or leakage of urine. This table has a lot of information and it's worth going over. It compares all of the different treatments for BPH, all the way from medicines to combination of medications to things that we talked about like Urolift, TURP, PVP, whole-up, robotic simple prostatectomy, as well as a few other treatments that we didn't cover in this video. It shows in the first column that the AUA symptom score improvement is highest after things like the whole-up and robotic simple prostatectomy. That means the symptoms have improved that the patient reports. The next column is urine flow and the average improvement in urine flow following either the medicine or the procedure. AUR stands for acute urinary retention, BNC bladder neck contracture or scar tissue of the bladder neck, SUI is stress urinary incontinence, and retrograde ejaculation. You can see all the different rates of these side effects of surgery, including erectile dysfunction and need for blood transfusion or secondary procedure. To summarize the surgical treatment of BPH, there are side effects for each surgery and those rates are all different depending on the type of procedure you undergo. Most surgery is very safe with low risks of side effects. Most men have greatest improvement in urinary symptoms after surgery compared to one medicine or a combination of the two medications we discussed. Thank you for your time and attention watching this video about BPH. There are many other treatments available that are on the market that we can discuss at a clinic appointment. We look forward to seeing you in clinic at Urology Nevada, and I want to make a special thank you to Dr. Steven Summers at University of Utah for his help with some of these slides, as well as his mentorship during my training. Please come see me or one of the other urologists at Urology Nevada. We'll be happy to take care of your BPH as well as any other urologic condition. Here is our website, phone number, address, and if you want to visit our website, you can use the QR scan in the bottom right-hand corner.